Welcome to the presentation of Meropenum Trihydrate by student number 3285168. Meropenum trihydrate belongs to the carbapenem subgroup of beta-lactam antibiotics. It is used intravenously, and its beta-lactam structure enables meropenum trihydrate to exert its bactericidal action by interfering with bacterial cell wall synthesis. This drug has a broad spectrum of activity against many aerobic and anaerobic bacteria. Meropenum trihydrate is indicated for treating various serious infections in adults and children over 3 months of age. A few to list are things such as lower respiratory tract infections, complicated urinary tract infections, meningitis, and intra-abdominal infections. The pharmacokinetics are best described as the following. Meropenum trihydrate is administered intravenously, eliminating gastrointestinal absorption. It also has limited oral bioavailability considering its hydrophilic nature, which prevents passage diffusion across the intestinal epithelium, resulting in limited absorption. Additionally, due to this drug exhibiting poor permeability, it is another key reason why it is not administered orally. As meropenum is unstable in the acidic environment of the stomach, resulting in extensive degradation. The volume distribution depends on the patient, but the average for a healthy subject is approximately 0.25 litres per kilogram. The drug can be distributed multiple ways, for example, an intravenous infusion over 15 to 30 minutes or an intravenous bolus injection over 3 to 5 minutes for doses up to 1 gram. Once meropenum trihydrate enters the bloodstream, the drug distributes widely throughout various body fluids and tissues, including lung, bronchial, secretions, bile, cerebrospinal fluid, skin, and more. Approximately 2% of meropenum is bound to plasma proteins, allowing for extensive distribution. Meropenum trihydrate undergoes minimal metabolism. The only metabolite is a microbiologically inactive beta-lactam ring-opened form. The drug is primarily excreted unchanged by the kidneys, with approximately 70% of the dose is excreted unchanged in urine within 12 hours. An additional 28% is recovered as the microbiologically inactive metabolite, and only about 2% of the dose is eliminated via fecal excretion. Meropenum trihydrate has a half-life of approximately 1 hour in individuals with normal renal function. Meropenum trihydrate has multiple mechanisms to exert its bactericidal effect. Firstly, meropenum readily penetrates the cell wall of most gram-positive and gram-negative bacteria. This is facilitated by its chemical structure, enabling it to pass efficiently through bacterial outer membranes, specifically referring to porins, which are mostly evident in gram-negative bacteria. Once the meropenum molecules are inside the bacterial cell, meropenum binds to specific penicillin-binding proteins, which are known as PBPs. By binding to PBPs, meropenum interferes with the synthesis of vital cell wall components. With this interference with cell wall synthesis, it leads to cell walls weakening and ultimately cell death. Meropenum displays stability against hydrolysis by most beta-lactamases. This stability contributes to meropenum trihydrate's broad-spectrum activity, further enhancing its effectiveness in fighting specific bacteria. Meropenum trihydrate can cause various adverse side effects, ranging from common and mild to rare and severe. The gastrointestinal effects likely occur due to meropenum's broad-spectrum antimicrobial activity, disrupting the normal gut flora. Meropenum can also cross the blood-brain barrier, which may explain neurological effects. Both the dermatological effects and allergic reactions are likely due to the immune system's hypersensitivity or allergic responses to the drug. Meropenum Trihydrate is classified as a Schedule 4 drug in the SUSMP. This indicates that the drug can only be obtained with a prescription from a qualified healthcare professional. The scheduling of meropenem ensures that the use is controlled and monitored by healthcare professionals to prevent misuse and the development of antibiotic resistance. Additionally, it is also important to note that the drug is available in various formulations and strengths. However, regardless of the specific formulation, the scheduling of meropenum trihydrates consistently a Schedule 4 substance. To test your knowledge, here are 2 questions on meropenum trihydrate.